Hey guys, it's me, Adam Deshawn. I'm here with another video. So today I'm going to be talking about something that plagues millions and millions of nurses around the world, and it is nurse burnout. I know I've struggled with burnout several times. One misconception about nurse burnout is that like once you're burned out, it's like that's it, and that you can't come back from it. That's absolutely false. I have changed several times in nursing, and I have experienced burnout several times, but you can always come back from it. So, this video is going to be talking about the signs and symptoms, how to recognize it, what are the causes, and how do you treat it. So, we're going to be looking at this thing like a disease process. Signs and symptoms, causes, and the treatments for it. So, one of the number one signs and symptoms of nurse burnout is anxiety. Having extreme anxiety about work, during work, leaving work, it's just a lot of anxiety. For being fatigued after a shift, a fear or dread of going to work. That's a huge one. If you know that your shift is coming up and you started to really like just really dread it and just like have a lot of anxiety about it, that is a huge sign of nurse burnout. Um, Being numb and lack of empathy is another one. If something's happening with the patient and you really just have a really nonchalant attitude about it, like you really don't care, huge sign you're burning out. You need to do something. So this is one that I'm guilty of when and when I am not in burnout. It's having like a dark, kind of a morbid humor about nursing. Okay, so I looked up some articles about nurse burnout and I kind of researched some signs and symptoms of nurse burnout, and dark humor was one of the signs and symptoms. I've had dark humor ever since I started nursing 12 years ago. So that's one of them. I still have dark humor and I don't feel like I've burnt out yet. Um, Treating patients like tasks, treating patient care needs like this is just something I need to check off on my list instead of recognizing that there is an human being on the other side of the care that we deliver, and just treating them like this is something I've got to done, something I've got to do, or something I've got to get done. Um, Excessive mistakes. And I put in there excessive mistakes because we all make mistakes as nurses, but making excessive mistakes over and over again, particularly the same type of mistakes, may indicate that you kind of don't care anymore and that you're not being as cautious as you used to be. It's a huge, huge sign of nurse burnout. So those are some of the signs and symptoms of nurse burnout. If you guys can think of something else, comment down below and let me know. So let's move on to the causes. Oh, this is a big part of the video. What causes nurse burnout? Um, One I have on here is poor staffing. Huge, huge. Poor staffing. Not having enough nurses or CNAs on staff to take care of your patients. You having a huge load of patients will make you anxious. Well, you can't do for 12 what you can do for 6. So having poor staffing is a huge cause of nurse burnout. Not having enough supplies. You know, how many times have you went to go do something and you don't have what you need to do, so we have to rig up something. Oh, I've done this so many times in the nursing home. When you don't have enough supplies, you've got to use different kind of syringes for different stuff. So you know that's one thing that can contribute to nurse burnout. Having not enough resources. That goes back to staffing. Not having enough nurses. I don't have any. A lot of times when I was working in the nursing home, we nursing homes usually run with a lot of LPNs, and just recently we just started to need to have RNs on staff. So not having an RN on staff to really do the things you need the RN to do. Poor management, huge. Poor management. If you have managers and nurse supervisors that A, don't know what they're doing, or B, don't care about what they're doing, C, or just don't know what they're supposed to be doing. Like a lot of times you hire in managers who don't know policy and procedure for your facility. So they're not helpful. If you go to them for a resource and they don't even know what they're supposed to do, let alone what you're supposed to do. So poor management, that can cause you to burn out. Um, Poor training. Poor training. And I put out in parentheses a too short orientation. How many times, you guys, my nurses that are watching, and my new nurses, you guys that are coming up that are currently in training for the hospital, wherever you're going to work, this has happened to me though, so many times. And I've seen it happen. So you have a nurse that's training, or a CNA, or whoever it is that's training, and they're in orientation, and but they come in one day and they're super short, so they need you to come off orientation and take your own load, but you haven't been adequately trained yet. So when you don't have the knowledge to do your job, along with not having enough supplies, along with not having enough staff, along with not having enough resources, you burn out. You get sick of it. You get anxiety, you get anxious, you get downtrodden about work. You start to hate it. So this is what causes burnout. Um, oh my gosh. Okay, I'm gonna skip this one and I'm gonna come back to it because this is my number one cause of nurse burnout. I'm gonna skip over that. Health insurance. Didn't think that. No, so this is the one I came up with myself about health insurance. So being that been a nurse, started nursing in 2007, I've started to realize how much insurance and health insurance plays in the way we take care of our patients. Huge one. Um, down to the documentation. Over the years, nursing has become less about caring for the patient and more about documenting what you've done. So you can spend 12 hours in a patient's room caring for them, doing everything they need, but that does not mean a hill of beans if you have not documented. So the 12 hours of actually caring for the patient may go to 6 hours. You have to chart about the care. So you've got to care for this patient in 6 hours. So health insurance is another thing that contributes to nurse burnout. The way health insurance has shaped and maneuvered the way that we care for our patients um, is a huge cause of nurse burnout. Um, Nurse bullying and eating your young. I'm sure you guys have heard of Nurse Blake. He's a vlogger that is champion against nurses eating their young and nurse bullying. Um, this is a huge thing, and this subject is so huge. I may need to make another video about it because I don't want to make this a 30-minute video. But nurse bullying and eating your young is a huge thing that contributes to nurse burnout. Um, Nurses, be nice. Be nice to the new nurses. We were all there once upon a time. This is a whole nother video. I'm not gonna get into it right now. But nurses eating their young, huge contributing to nurse burnout. Uh, um, Poor pay. So us as nurses, what we do from on a day-to-day basis will never be adequately compensated. You cannot pay me for holding the hand of somebody while they're dying. You cannot pay me for adequately for all of the things, the special things that nurses do. So we nurses will never adequately be paid enough. But in some circumstances, a lot of places are not even meeting the state minimum of what they should be paying the nurses. So if you go into work every day, do all this work, and care for these patients, and you're not being adequately compensated for it, nurse burnout. Boom. Okay, so going back to what I said is the number one thing that contributes to nurse burnout in my eyes is too much overtime. You didn't see that one coming, did you? I know this because me being CNA, LPN, RN, BSN, back in the day, I used to I was in my facility all the time. I busted overtime wide open. I was in there so much, like I was like addicted to it. It becomes addicting. I worked all the time. Over time, I was a new LPN at the time, and then I was a new CNA at the time. When a CNA, I really did a lot of overtime. But when I became an LPN, I saw that fast money coming, and I always worked too much, and I started to see myself get really low energy. I start getting really anxious because I was working too much. And I see this so much with nurses, especially newer nurses. And it's so easy to do because where you're working, they always need help. They're always short. So overtime can be addictive and you wear yourself out and you become burned out. I see that working too much overtime is one of the number one contributing factors of nurses burning out. Huge, huge. Okay, so now that I'm done with the causes, you guys, let's talk about what can you do to overcome and get out of nurse burnout. Once you're in nurse burnout, you don't have to stay there. You can come out. You can start to find yourself again. So one way you can deal with nurse burnout, speak to management. Doesn't really help if I said like if one of the causes is bad management, but in some cases, most of the time you have decent managers. Speak to them. Let them know how you're feeling. And they can absolutely give you ways and techniques to deal with it. If the problem is staffing, talk to them about staffing. If the problem is supplies, like we discussed earlier, tell them, hey, we need more of this. Can you order this? So man, that's one way you can really overcome nurse burnout and treat it is speak to management because if they can't fix what they don't know about, and recognize you're not alone. Um, Another thing that you can treat nurse burnout is changing jobs or going to other units within the same job. Something I've done. You guys, I don't want to say I became burnout at the nursing home, but I needed to change. So working at a nursing home or a long-term care facility, if you start getting burnt out, hey, change it up. Go to home health. Go to a clinic. Go to in some hospitals. Changing jobs and units. If you're getting burnt out on one hall at your facility, let's say you work on the Alzheimer's unit, maybe you need to change over to the rehab unit or something like that. So they can kind of spark a new pleasure for nursing. So considering doing that, go on vacation. If you've been if your job long enough to acquire vacation days, go on vacation. Get away for a week. We do hard work. We need time. We need time to have self care. People go on vacation. Take a week off. Go away. That will absolutely treat nurse burnout or help treat it. Remember why you became a nurse. So many things we really lose the core reason why we became a nurse is to help people because everything is so shadowed with technicalities. We forget why we do this and we become burnout. So if you take a minute, if you start to feel yourself getting burned out, if you start feeling those signs and symptoms that I mentioned earlier, if you start recognizing those things, remember why you became a nurse. You want to help people. And if that's not why you became a nurse, you need to go back and reevaluate. It's not about the money. Something I've done several times. Go back to school. You will be amazed how going back to school to further your education or take a different route of education can re-spark your thrill for nursing. CNA, kind of got bored with it, went back to LPN school, triggered a whole new respect for nursing. And then RN, I started getting a deeper knowledge of nursing. Then when I got my bachelor's degree, it kind of re-sparked my love for what I was doing. So consider going back to school. As a nurse, you can never really have too much education. Even if you become a PhD in nursing, you can always go back and get different like certificates and degrees and certification. So go back to school. And then finally, one way to treat nurse burnout is recognize the signs. Start recognizing the signs and symptoms that I mentioned earlier about nurse burnout. Recognize the signs. Recognize the signs in yourself, and it looks different in different people. You know, if you start the bigger one is if you start really not caring about what's going on at work. If you can fly through a whole shift and look back and not remember what the hell you did for 12 or 8 hours, we need to reevaluate. Something's wrong. Something is wrong. That's it, you guys. I know this video is still ended up going to be 15 minutes long, and I'm sorry. I'm going to be doing a live right after this video. So if you're watching it now, go back to see if I'm still on live. I'm only going to do it for a few minutes to see if you guys have any more questions or concerns. Follow me on Instagram at Adam Deshawn, ADAMDASHAWN. Subscribe, share, do all that good stuff with these videos. I love you guys. Sorry that this video is so long. I will see you soon. Bye.